Good evening to everyone.
Good evening.
How are you?
Okay, fine, thank you. Thank you all so much for taking the time out of your busy schedules to be here this evening. We're so appreciative to you in all of the efforts that you are behind throughout the community. Before we begin our discussion and presentation this evening, I think it would be very appropriate to ask for a moment of silence in recognition of the 19 students and 2 teachers who were lost to senseless gun violence in Uvalde, Texas. And I'd ask that Dr. Sunithia Newby please come forward at this time.
Thank you, Alan, and good evening to everyone. Of course, as we begin to have this wonderful conversation about how we will work together to find solutions for gun violence in our community, as Alan stated, we would be remiss if we did not take a moment of silence to acknowledge the lives that were recently lost, not just in Texas, but also in Buffalo. But even bringing it closer to home, we've lost so many lives here, right here in the city of Newport News and in our region. And so if you would just join me in a moment of silence. And as we have reflected on the lives lost, I think it's not by happenstance or coincidence that we're all here in this space together seeking solutions. And I think it creates a wonderful opportunity tonight to not only look at what our individual organizations can do, but what can we do collectively? What are the ways in which we can collaborate to create innovative and creative strategies that will make a difference in the lives of young people and young adults here in our community? So again, I thank you so much for taking your time to be here with us. It's our pleasure to begin the program, to begin this conversation of solutions and resolutions. And thank you again for joining us in this moment of silence. Alan.
Thank you, Sunithia. I'd also like to recognize a few public officials, and I hope I've cleared all the mist from my glasses here. But on the first row, I see Dr. Sandra Cherry, our Vice Mayor. Thank you, Sandra. I also see David Jenkins, and I see a school board member, John Ely. Thank you, John. Have I missed anybody? And if you're here representing other VIPs and special dignitaries, once again, thank you for joining us today. Well, I have the pleasure of talking about a lot of very important work that a number of us have been trying to accomplish in the city over a number of years and summarizing that into 10 minutes. So I'm going to really just touch on a few things to give you a sense of an introduction about how we got here this evening and why this moment in time is so important. As many of you know, a lot of this work got started a number of years ago. We've gone through a number of iterative discussions and intentional kinds of decisions in the city. Some of you may recall a number of programs that we've had over the years, ranging from our Office on Youth Gang and Violence Prevention to street outreach workers, to various efforts throughout the community, our STEP program to give individuals an opportunity to excel with summer employment. And these things didn't just happen by happenstance. They happened because we had a council and a community who really compelled us to try to address these conditions that we're dealing with even today as they persist at a very important time as we were experiencing them here in the city of Newport News a number of years ago. So in some way, I feel like many of us, including you all in the community, have been working behind the scenes to try to reduce violent crime and gun violence here in the city for a number of years. we've been very fortunate to have received a grant from the Department of Criminal Justice Services to help us conduct a community assessment. And is Dr. Keener? There he is. He doesn't dress like a professor. I'm looking for a tie and corduroy coat with patches on the elbow. We've been very fortunate to receive this grant. We were actually one of 6 cities that were named in legislation 2 years ago for us to be able to take advantage of the research capabilities. We could determine, who could provide that research for us. And we chose to go to Christopher Newport University because they were putting staff and they were putting money behind a brand new initiative program that they wanted to offer to the community in order to help cities here on the peninsula understand the very dynamic issues that are happening in their communities around crime. And so they became our data partner. And over the last month, as part of this community assessment, they have been conducting a lot of very valuable and important data. We had an opportunity to hear a glimpse of that at our City Council work session on yesterday. But what's so important about that data is that it gives us a baseline from now going forward to really measure our work as we engage the community, as we engage you, and as we provide funding to organizations to increase our capacity in the community to address this problem. We have now a definitive start, and hopefully we will have a destination point in mind that's on the horizon that we will gradually work toward and be able to celebrate over time. So Dr. Keener is going to also present a summary of some of his findings tonight. Because what we want to try to do is we want to try to create some alignment with the gaps and the needs that his survey revealed. We also know that many of you are already doing important work in the community now. So some of it may not be necessarily new to you, but it will provide you with sort of a fresh way of looking at the challenges that we face around gun violence. So in the past, we have generally worked around a model that we refer to as just our PEER model. And there's nothing fancy about the acronym PEER. It's just easy to think of PEER in terms of that acronym because it just stands for prevention, intervention, enforcement, and reentry. And so most of the activities that you might be doing now or that you might be proposing to either develop or build on generally will fall into one of those 4 categories. And we're going to focus particularly tonight on the importance of prevention and intervention. Those are going to be the 2 components of our PEER model that we want to continue to build out. And that's what we're going to give you an opportunity to do in terms of receiving this funding to help your organizations do a better job, become more effective, and really give Newport News an edge and a level up on other communities. This has become a critical issue for all cities throughout Hampton Roads. You've probably been watching the media. It's a critical issue across the country. But here in Hampton Roads, the mayors and the city managers have all been engaging, trying to figure out regional solutions. And I'm proud to say that we've always been a leader in putting forward ideas. And this funding and this opportunity will continue to provide us with an opportunity to lead and to make a difference. So with that background and introduction, I'd like to move to the next phase of our agenda, which is just to hear some of the preliminary findings from Dr. Stephen Keener at Christopher Newport University. He has a tall order. He's happy to answer your questions. You all could probably be here all night. And we don't want to take that much time. So we're going to ask him to speak for about 15 minutes, and he's going to provide you with contact information. Dr. Keener and his staff have also pledged to continue to work with Newport News to help us benchmark our effort and continue to help us improve as we go forward. So he's going to be with us. You're not going to just see him tonight. They're going to continue to support this valuable work in the city of Newport News. So, Dr. Keener.
Hey everybody, how y'all doing? Hello. Hey. Okay, so the one-page handout that hopefully you picked up on the way in, these are some of just these high-level findings that Alan referred to in the survey. A couple notes on this before we get started. One is this is very high level, meaning this has not got a lot of detail in it. We are providing plenty of detailed analysis to city leaders. We have a full detailed report. And so these are just some of the major takeaways in our first run through of the analysis of the data. And I'm not here, I mean, I love data, don't get me wrong, but I'm not here just to throw data at you. The way I think through this, if I was a community organization doing the work that you all are doing, is the survey is helping us identify things that are concerns in the community, things that are maybe gaps. But with this, many of you are already working on these issues. So as you go through this grant application phase, I think of it as, well, if, for example, some of you may be working on mental health. I'm going to talk a lot about mental health. If you're already doing that kind of work, I would recommend in your application citing that, right? That like in the community survey, we found that mental health is a major concern of Newport News residents, and my organization is doing this kind of work already, right? Just illuminating that you're already doing that work, and you can show how you can contribute to those efforts going forward. So a couple things in terms of just our major findings and this is across all groups, and so what we're doing throughout the final report is we're doing some detailed analysis within age groups, within race, within education levels, within zip codes and neighborhoods to try to see if there's variance across those various factors. Now, one thing I'm going to note throughout especially is what we found with young people, because I know a lot of you are working with young people, right? Young people disproportionately are impacted by gun violence. We've known that for a long time, through our national data. And so I'll highlight some things as we go through where young people either had higher level concerns or higher level of dealing with these issues, especially as you think through the work you're doing with that group. So just the top line, we had an array of questions that asked, do you feel safe? Do you like the quality of life in your neighborhood? Is your neighborhood a place you like to live and work? All these things. Has your perception of safety changed in the last few years? We asked some questions around that. In general, people felt pretty safe in their neighborhood. That was pretty consistent. However, there were a couple things that stood out when we did some various other analysis. One thing was that feeling of safety dropped at night. Between day and night, people felt less safe at night. That was one major thing. The second thing were people of color felt less safe than white respondents. And there was actually a couple zip codes that we've pulled out that have higher levels of feeling unsafe, especially at night compared to other zip codes in the city. So that, especially if you are working in some of those neighborhoods that are dealing with higher levels of maybe violence at night, you could illuminate that is something we found in the survey. So it's not just anecdotal, there is data to that as well. Also, we found that young people were consistently more worried about safety concerns, and that was not just in these questions, but other things as well, especially our 25 and under group and also our 26 to 30 group. So that was the first thing. In general, respondents were generally satisfied with policing. In the community, there was some variance around certain neighborhoods feel like they were under policed versus over policed. Some neighborhoods want more police, some want less. Once again, our final report will have all of that. But what I think will probably be of particular interest for you all as you're working through these grant applications were concerns. Because we had an array of questions asking, what are your concerns at the neighborhood level? And then what are the kind of challenges you deal with on a daily basis? What are things that you're worried about? And the mental health element, which I alluded to earlier, that showed up consistently across multiple questions. People were concerned about mental health issues in their neighborhood. People were citing mental health as something they deal with, a challenge they're dealing with consistently every day. And that was especially true for young people. Our 30 and under respondents had high rates of concerns around mental illness and had high rates of concerns or citing that as a daily challenge for them. Beyond that, you can see now, one thing I do want to note is you notice that we have 14 primary concerns that were identified in the survey. There were more than 14 things that you could have responded to, right? So this is the top tier. There were plenty of things that aren't here because they were not cited frequently as a concern. So what you're seeing here is the top 14. For example, I think this was a media question last night after the presentation. It's like, well, people don't seem concerned about gangs. It's like, no, that's not the case. People are concerned about gangs. It wasn't cited as much as mental health, but it was still one of our top tier of concerns, right? So those of you working on gang-related issues, that is in that top tier. So just because you see it at 14, don't think of that as something not to cite if you're doing that kind of work when the grant application time comes around. Now, with all of these, young people generally were more concerned than our older respondents around all of these. So not just mental health, they were generally, but mental health is the one that stood out consistently as young people having the disproportionately high rate of concerns or challenges around it. But young people were still, for example, there was quite a bit of young people that were citing were concerns around fighting and around gun activity as well. So it wasn't just that, but that was a concern. Now, I've talked about the mental health a little bit, but you can see a little bit below those respondent concerns, some percentages there. Now, we also asked a question around, what is something, what we're trying to see is, for example, are people more concerned on a daily basis with things like mental health or with things, with things like homelessness or having access to transportation or financial concerns? And still, when we're asking those questions, various mental health concerns showed up 1 and 2. But beyond that, financial concerns showed up quickly after that. Paying your bills, paying for your family, but that's where you start to see some straying among age. Our older respondents were citing more financial concerns, or our younger respondents were more likely to cite those mental health concerns. So that younger people were still citing some financial concerns, but not the same rates that our older respondents were. So those of you, once again, working in these targeted age groups, you can think about that. Now, when it comes to gun violence, because that's obviously the big focus here, gun violence was a major concern, and it showed up in different ways. What was fascinating, I think the first run through is we asked a question, essentially I was getting at, when it comes to gun violence, are you concerned about yourself being a victim, someone close to you being a victim? Are you concerned about being arrested? Are you concerned about going to jail or prison? Those kind of questions. What we consistently found in those questions were people were more concerned about someone close to them, their family or friends being a victim before themselves. They were still concerned about themselves being a victim, but they were very concerned about people in their primary vicinity being a victim. Same thing with coming into contact with the criminal justice system. There was a lot of concern about family, friends getting arrested, going to jail or prison before themselves. Now, this is also where we see the levels of concern were much higher for our younger people and our respondents of color. So once again, especially our younger respondents of color were more likely to cite concerns of their friends or family being victims of gun violence, friends or family getting arrested, friends or family going to jail or prison, while also being concerned about themselves. They weren't just not concerned about themselves, they were just more likely to cite the family-friend concerns before themselves. Now, last little bit, we asked questions around community resources, like what do you see as a valuable community resource? What do you use? You can see in that graph, people citing schools, stores, churches, after-school programs as things that they saw as beneficial to their community. But one thing that I want you all to think about that we saw is we also asked a question, what are barriers to access? For example, if you have great community organizations in your neighborhood, and you're not using them, why? And what was consistently came across there was people didn't know how to access the resources, and that was once again especially true for young people. They said that even if they were aware of the resources, they did not know necessarily how to access them. And the way that I think that stood out a lot to me, because we talked about mental health a lot, that's something where if I was in your all shoes, I would think, well, you can be doing great resources, and you're going to have to obviously put a lot of work into outreach, bringing down barriers to access, but especially with something like mental health, where we see in the literature lots of stigmatization, lots of resistance to reach out to those resources. That's where you're really going to have to be cognizant of increasing access, decreasing barriers, because that was consistent across all respondents, but especially young people. And this was like compared to the other options were things like hours, transportation, don't think the resource is valuable. Those were cited somewhat as barriers, but more frequently was people just didn't know how to get a hold of those barriers. Now, or those resources. Now, this is just a one-page summation. What you'll see at the bottom, that's our email for our center, the Center for Crime, Equity, and Justice Research and Policy. I almost stumble over that every time. I don't know why we made it such a long name. So I'm the director of that center. My co-director, Dr. Lane Burdell, we're on that email all the time. If you have more questions about beyond these high-level findings, like some of our age findings, zip code findings, race findings, I'll be glad to share them. We're working on this final report for city leaders now, but we've already done a good bit of analysis that's at least got some of our high-level stuff. So once again, I hope this is helpful for you all, but don't think this is all. Like, there's a lot more there. And so, for example, especially, I guess the way I would emphasize this is if there's something here that your organization is doing a lot of work on and you want to know a little bit more about what we found around that issue, feel free to reach out and I can kind of let you know, hey, this was showing a lot with these respondents or, X, Y, and Z. One other quick note with, our participation. The approach to this was a census approach, meaning we're trying to get as much participation as possible. Downside of that is we didn't do any kind of random sampling, which means our participation, which we had over 2,000 respondents, which in the day of having difficulty getting people participating in surveys, I was happy with that in total, but it's not a perfect representative sample. And so that's why we're doing some of this analysis within age groups, within race, within zip codes, to try to get around the fact that if we just look at the respondents as a whole, that's skewing the perceptions of Newport News residents, right? We're trying to dig into some of that stuff. And so any way I can help you all illuminating those findings or, informing you about the findings, illuminating, kind of walking through what we've done to get to this point, I'll be glad to do it. And I know I don't have much time tonight, but I'll be here till the end of the meeting if anybody wants to pull me aside, ask questions tonight, or email me going forward. All right. Well, thank you all for thank you all for being here, but thank you all for the work that you do. I cannot emphasize it enough. I think in my presentation last night, I want to emphasize that the role of community organizations in dealing with these problems is, that you are the key to doing this, right? And so I really appreciate the work you're all doing. From a research capacity in the center, if we can help you all do your work, if we can help you on this work or others, please let us know. That's what we want to do. We want to help you all. We're researchers, but we do want to help our research in the community. Question?
So I just wanted to know your name again.
Oh, yeah, Stephen Keener. Yeah.
Stephen Keener?
Keener, yeah, Keener.
Okay, thank you.
Yep.
When will the final report be out to the citizens of Newport News?
Hopefully within a couple weeks. I don't plan on sleeping for a couple weeks, so. But no, that's our goal. It's coming. So I mean, like I said, our major findings. We've already, we've got a lot of the major findings. But this final report, we want to be very detailed for city leaders and the community to see that we don't, once again, just want to do the high-level stuff. We want you all to be dig into especially specific concerns or specific issues you're working on. So, yeah.
I'm just curious, similar to when they acknowledged that SATs no longer are relevant for different communities because they are Western Caucasian based. I'm just curious as to how there's a lack of any questions delving into the effect of systemic racism and that quality of oppression on families and individuals.
We do have.
When you come up with these answers, I don't know why we always ignore the elephant in the room as to how that causes the mental health issue. How does the father come home angry, the mother's? Why is it always so surfacely protected and not honest?
A couple things. That's one, it's a very good question. But there's a couple things there. One is we do have a section that on experiences, discrimination, prejudice, racism, that is going to be, that's a section of the final report. We presented some of those findings last night. So there's questions were asked. The things that you're talking to about what leads to that, in something of this nature, an exploratory survey, I would love to dig into that more. We're doing some focus group things to try to dig into some of that detail, get some of that context with what, we see the quantitative high-level things, but it does lack context on things like you're talking about. And so that's the next stage of where we're into, is doing focus group interviews, especially with targeted groups that were underrepresented in the participation, to try to bring those voices to this. It's not perfect, but.
I have a suggestion.
Yeah, sure, yeah.
It sounds simple to me, but maybe not to you. When we are told that people of Black or African descent and people of Hispanic feel a little bit more trepidation, anxiety, it would be wonderful for the first time to go to a meeting in Hampton Roads, Virginia, where the people presenting were Hispanic and Black as the experts for the systemic things that we're dealing with, because it takes more than a survey the traditional way to get to the truth, and you're only going to get the polite, correct answers. And it's not really that complicated. Neighborhoods need to have an infrastructure that includes recreational opportunities and all sorts of things. But you're always doing surveys, you're always doing intake, and it sounds wonderful, and you put it in computer, but it's not changed. It's the same issues. So I guess I'm frustrated because I'm getting old. I think I'm gonna die before I see a reality thing change. No, I'm almost 70. I'm a 50, use the F word. I've been coming to these meetings and you're all proud of yourselves, but it's the same conclusion and it's the same solutions with the same outcome. And it's not that complicated. It's just people wanting an infrastructure that works. And we need to see the suits sit down. We need to see the people that are not being involved directly give credence to those that are dealing with it and let them be the spokesperson. It's easy. It's called shifting it so the visibility is improved. I'm gonna leave because I want to watch Chicago 3 that we're gonna do tonight. And I know you're gonna come up with the same conclusions. I wish you all the best, but it's not that complicated. You don't need to do any more surveys. A 3-year-old is a 3-year-old, a 15-year-old is a 15-year-old. Let's give power to the people that are actually doing the work. I guess I'm irritated. Lots of love to all of you. I'm getting too old for this, man.
We're gonna have a private Q&A time.
Except when I think you helped when I collapsed at the police thing, remember?
Oh, yeah,
Yeah, I can't take the son and have MS, and if I get angry, they know they have to get the ambulance. So let me go. I wish you the best. Enjoy your picnic. Thank you.
Yes, ma'am. I do see your hand there. If you all could do us a favor, what we want to do, we have created an extensive Q&A time as we get towards the end of the presentation. So if you can remember to just jot your question down, we've left great amount of time at the end to make sure we get all of your questions. So thank you, Dr.
Yeah,
King.
thank you. And once again, research stuff I can answer. Some of that stuff, that's out of my.
Good afternoon, everyone. Evening, rather. My name is Miranda Eccles, and I am the Community Resources Coordinator for the Newport News Police Department. And my part of the agenda is to really just take a little moment to highlight what we call risk factors, the CDC risk factors. So as we're doing this work, Dr. Keener gave us this high-level overview of what some of the responses were concerns for our community. And so how do we tie that into what are our risk factors? First of all, we talk about, most of us have heard the term adverse childhood experiences. I know a lot of you all in the room, and you all have been doing this work for a long time. And so a lot of this is preaching to the choir, but for those who don't know, an adverse childhood experience is defined as a negative experience in childhood or your teenage years that may put you at risk for chronic health problems, mental illness, substance abuse in your adulthood. And what we know is that if these traumatic experiences are not dealt with, then they do show up, unfortunately, in negative manners in our adult experiences. And so I want to take a moment to highlight what we consider, or what CDC, so this is research based, what do they consider? What are some of these risk factors that contribute to these adverse childhood experiences that we know if they're not dealt with, we continue the cycle? And one that we know is that when our young people feel disconnected, when they feel disconnected to their homes, when they feel disconnected to their school communities, when they feel disconnected to their neighborhoods, that contributes to things that can cause them to be involved in negative behaviors. We also know that when they consistently exhibit delinquent behavior, right? So what is the result? What is driving this behavior? And what is it going to take to address? So if we know that a child is consistently portraying these delinquent behaviors, we know that there is something that's going on, and we know that if it's not addressed, then that becomes a risk factor that needs to be addressed. Something else that we know, and unfortunately we see it all the time, is that when there's a high level of conflict or negative communication styles, we see, for some of us who are older in the room, we say kids don't fight anymore. And it's not that we encourage kids to fight, it's just that now they shoot each other. And really what the basis is that they don't know how to resolve conflict. They don't know how to communicate. They don't know how to deal with things that happen. And so they resort to violence, or they resort to things that they see because they have not seen anything different. And so we know that if those things are not addressed, we know that if it's not dealt with, that it's going to lead to an adverse childhood experience, not only for the child, but also for the community. We also know that risk factors are not just individual and family, but risk factors are also in the community. And so one of the things that are highlighted as a community risk factor is communities who do not have activities for young people. We hear all the time about how young people don't have anything to do. How young people don't have anything meaningful to do. And when I was growing up, they taught me an idle mind is the devil's workshop, right? So we know, somebody say amen. So we know that if we do not provide positive opportunities, engaging opportunities, meaningful opportunities for our young people to get involved with that leave them with this time to do things that we wish they would not be involved with. We know that communities with high level of social and environmental disorder. We saw from Dr. Keena's presentation that came from the respondents, one of the number one concern was mental health. And we know that particularly since we've been in this pandemic, our communities had the level of those who identify mental health concerns has risen. And so we know that it's contributed to a number of things. And so we know if we don't deal with this mental health issue, it's not going to get better. It's not going to get better if we don't deal with it. Unfortunately, it's going to get worse. We also know that easy access to drugs, alcohol, guns is a risk factor. And unfortunately, we see it. We all can talk about the experience that happened, unfortunately, in Texas yesterday. How does an 18-year-old get access to an assault rifle? And we all have our own opinions on whether or not, on gun laws and whether or not they should be strict. But what we do know is that if we don't deal with how young people access guns, then we know that we're going to continue to have this problem. And one more thing that I'll highlight is that neighborhoods that do not look out for each other, it's considered a risk factor. There was a time when we were growing up where if you were my neighbor and you were doing something wrong, as a neighbor, I could speak to you. And in some communities, in the neighbor, I might discipline you. And we're not advocating for you to put your hands on nobody's child. We're not going to jail for nobody. So we're not advocating for that. But what we are advocating for is really let's get back to neighborhoods. Let's get back to a time where our community cared about our community. Let's get back to a time where a young person in the community belonged to the entire community. And what we see and what the CDC has said is if that does not happen, that's a risk to our community. And so a couple things of how can we address these things when you're thinking about your application. And the reason why we wanted to point this out is because when you're creating your proposal, we don't really want you to just pull something out the sky and say it sounds good. We kind of had enough of that. So we really want you to be intentional about how you're doing your application. Think about what the concerns were that would identify in the data, but then also refer to CDC's website and what they say not only are the risk factors, but what are the protective factors? Can we create programs that include mentorship? Mentorship, I think, is a word that sometimes is thrown around because it sounds good, but let's really get to what mentorship really means. Let's get to how mentorship provides that positive role model for a young person. Let's get to how mentorship provides that level of connection for a young person, because we see that a risk factor is if they feel disconnected, they may be more highly likely to engage in something that they should not engage in. So if we're going to mentor, let's not just put mentor on a piece of paper, but let's really define what mentorship means, and let's tie that back to a risk factor, a protective factor. We also know that if we can provide safe access for engaging after-school program and activities. Our school system do a wonderful job of providing after-school opportunities, but we also know the school system can't do it alone. So here in our local communities, let's also think about what kind of programs that we can do that is engaging to young people that they want to participate. Because sometimes we think our idea is a really great idea, and the young people are like, I don't want to do that. I don't want to do that. So as you're creating your programs, even think about, because we're talking about making sure we're target 13 to 24-year-olds, consider talking to some 13 to 24-year-olds and see what's important to them and see what they want to do and build that into your applications. Create a community where violence is not tolerated or accepted. We have to say enough is enough, and we have to do it in our actions. And then lastly, it talks about providing opportunities for families. So we know that if we create this wonderful opportunity for a young person, but then we send them right back to the same dysfunctional environment, we're really not, unfortunately, changing a life. So when you're thinking about your programs and when you're thinking about your proposals, see if there's a component where you can not only serve the young person, but also serve the family. And if it's not something that you can do on your own, collaborate. Partner with somebody who can help get this work done, because we can't do everything by ourselves. Alone, we can only go so far. But if we partner up and really get serious about getting this work done, we really can go a long way in getting it done. So again, my part, preaching to the choir, is as you're considering your proposal, think about the risk factors. Think about the risk factors that exist as an individual, as a family, and as a community, and then address them. Address them as part of your protective factors in your application. And like Dr. Keenan said, don't just pull it from the sky. Make sure you write it down. Make sure you write it down and tie it back into it.
All right, thank you, Miranda. Are y'all invigorated? I felt invigorated. Do y'all feel invigorated now? Miranda has just laid well, thank you. You took my paper. Okay, thank you. But thank you all so much. So I think Miranda has laid a great foundation for us to begin to segue into what does this application process really look like for you? And that's part of what we wanted to do tonight. So I'm kind of leading us into the next member of our team who's going to walk you through our application. But I'm hopeful that each of you, when you signed in, should have gotten a packet, a bundled packet that looks similar to this. If you did not pick it up, David has some, just raise your hand. You'll want to make sure that you have this, because what we're about to reference are the instructions that will help to guide the application process. And so we printed out copies for you, but it'll also be available online if you want to download it to your computer. So let's begin to bring this into focus about what this means for your organization. On page 2 of the packet, make sure that you review the eligibility requirements, okay? You don't want to take the time to begin an application process without first making sure you are eligible. Your organization is eligible to apply. So a couple of things that are very important to remember with your eligibility requirements is to make sure that you are a legal business entity that is registered with the State Corporation Commission for the state of Virginia. Make sure you have an active and valid business license, and make sure you have a government-issued employer identification number. You can be a new business, you could be an existing business, okay? But make sure that you have the requisite documentation, because you will have to upload that into the portal, which David is going to go over with you. Something else that's important is if you identify as a local nonprofit 501c3 organization, you'll have to provide your documentation to verify your 501c3 status. Okay, so again, we go over eligibility because we don't want you to do the work of applying and then we have to say, oops, you're not eligible because you haven't met the basic requirements. Something else that's important to remember is that for eligibility, we're looking for those who are serving youth and young adults, and you're already potentially doing work or have planned to do work around gun violence reduction. Miranda mentioned the age bracket of 13 to 24. We want to encourage you to think about that age bracket as you're pulling together your projects and your proposals. And that's based on literature and research that we found from across the country, that that's a target age group that you really want to look at. What's the age group again? 13. Got it. All right. So a word for faith-based organizations. You are encouraged to apply. If you provide community services for secular purposes without regard to the religious affiliation of the recipients or those who are going to participate in your project or your proposal, you are encouraged to apply. Also, please note that if your project is going to have you working with young people, those who are under the age of 18, if you are awarded a grant from the City of Newport News, within 30 days of the award, you will have to provide documentation that has a list of all your employees, your volunteers, and your contractors who will be working on this project and on this initiative, and it will have to show proof that you have a valid criminal history and sex offender search completed because you are working with minors. And that is based on a code section that is written there in your instructions, so you can go, don't take my word for it, make sure you look up the code section to verify, but we have to make sure that we are doing our due diligence to ensure the safety of our young people and those who will come into contact with them, okay? Last thing I want to say is we talk about eligible project proposals. Of course, what makes a proposal eligible is that it's focusing on working with youth and young adults around the area of gun violence reduction. It can support new prevention or early intervention projects, or if you have an existing program, you can expand that project or program or replicate it. You can use the funds for that purpose. So again, you can create something brand spanking new using the basis of the research that Dr. Keener has provided, also referencing the risk factors for the CDC that Miranda talked about. You can create something new based on a need, or you can take existing projects or programs, expand them, or replicate them. All right? Other things to remember as you're moving forward, and Miranda talked about this, it's a word that starts with a C that we highly encourage you to do. Can anybody guess what that word is? Collaborate. What is it? Collaborate. Give it to me one more time. Collaborate. Collaborate. We want to encourage you to collaborate. Unfortunately, not just here in our local community, but I think we see it in a lot of communities where you have organizations who are working in silos, right? And so everybody's doing their own thing. And what's interesting is that many organizations have the same focus area, they have the same type of projects, but they're working independently. So here's the power of collaboration. We can get more done together. We can go farther down the road together than we can individually. I think if we look at the wonderful things that we have accomplished as a community and ask ourselves, how much farther could we have gone if we had more resources? And resources could mean money, but it can also mean staffing and people. So when you're thinking about collaboration, connect with other people who are working in the same field with youth and young adults between what age bracket? 13. Y'all are on it. Think about collaborating in meaningful ways versus trying to create something just new for your organization. This is a challenge for us to not think about how we can just make the name of our organization great so that someone can say, oh, Sanithia's organization did that, or Mr. Hickman's organization did this. Let's think in terms of how we can say, together we were able to accomplish X, Y, and Z. Okay, so that's my spill on eligibility. Again, you have that document in front of you that has more details and information. If you have questions about eligibility, just jot them down for me, and we're going to go through them shortly. So I'll turn it over to David Duck.
Coming with all the equipment. Thank you, Dr. Newby. I appreciate that. My name is David Duck. I am the Youth Programs and Outreach Supervisor for the Department of Human Services. But in the context of this project, I will be your point of contact. So that also means either a really great resource to you or the person that gets on your nerves because I won't stop emailing you. So you probably already received a few emails from me. We have a question card in the back. A few emails from me just kind of introducing what was going on here and inviting you to this session. I'll be emailing you, a couple times a week just to follow up about the timeline and what's going on here, just to make sure that we don't lose anybody who wants an opportunity to apply for these funds and to impact our community through this project. So I wanted to do some technical work here and introduce you to the application portal. And all the information that you'll see here is also on that 4-page sheet that Dr. Newby just went over with you. So I won't read every line. It's pretty straightforward, but I wanted to make sure that we got a little bit familiar with it. And I also want to make sure everyone knew that after all of this is said and done, you can always contact me, email me, and I will help one-on-one or facilitate some group sessions for anyone who needs additional assistance with this application process. So we are here for you from start to finish, all right? So just wanted to draw your attention to the first page here. Once you go and click on the actual link to come to the application, you'll be greeted with this page, which is basically the 4 pages that you already have in your hand, the exact same information. If you click this top corner that says instructions, you'll be able to download that into a PDF form so that you don't have to try to make a copy or scan the one that we have here tonight. It's all there. We do want to make sure that you read through that and make sure that you understand everything there, and that if you have any questions about it, that you email me. All the information that they covered today is also there too, so everything is all covered, it's in writing, and we wanted to just have a conversation about it tonight. So you'll see that background information that was covered, and as you scroll all the way down to the bottom of those 4 pages, you'll see the timeline there, to kind of give you an idea of what the timeline looks like for review of these applications and the award process. And you'll click the button that says Apply Now. And once you click that button, you'll be taken to the next screen, which gives you some information about this actual application process and how it saves. So I know many of us have done online applications and done a bunch of work, and then your computer cut off, or you forgot something, you had to go get the biscuits out the oven or something like that, and you came back and everything was gone, everything was deleted. That's not gonna happen with this application here. It's your progress is automatically saved as you enter the information. And all you'll need to do is either bookmark this page as soon as you start working on it to refer back to it, or this little link here, you just copy and paste it and save it somewhere, and it'll bring you back to your unique application. So you won't have to worry about losing that information and having to restart. That can be really discouraging from completing something like this. So just wanted to go through some of the sections. It's broken down into 5 sections. Section 1, or part 1, is just general information. And this is where you just want to put all of the requested information about your agency. One of the important items to note here is this question about, is your organization a legally recognized 501c3 organization? You have a yes or no. Depending on the answer that you select here, that will change the required documents that you'll have to fill out in the section at the bottom that we'll get to later. So it's really important to make sure that we answer that one correctly, because you'll get to your required documents, and if you haven't answered in the right way, they'll be asking you for things that you may not have. So we just want to make sure that we highlight that part. Section 2, you just want to respond to the listed questions as it relates to your organization's purpose, the mission, the objectives, programming that you already do, the projects that you already do, and the services that you offer. And you want to address how your organization benefits the City of Newport News and the people living in the City of Newport News. Moving on to part 3, this is where we get into the nitty-gritty about your project, right? So in this section, we're going to talk about your proposed project, the need for the project, the problem that you're going to address, the anticipated implementation activity. So what are you actually going to do? Some of your goals and objectives. It's all listed there in the description. You want to refer to some of those risk factors that Miranda talked about, and how your project addresses those risk factors. So we're trying to set it up so that you know exactly what the issue is, what methods that you can take the information that's presented, and what you do in the organization and your mission, and meld those together to make an application that will ultimately, hopefully, be approved. In the name and the description of the project, one of the things we also wanted to point out is sustainability. It's going to be really important. We want to explain how our organization will continue this project after the funding has expired. So we want to make sure that after this money runs out, if there's other opportunities for additional funding, then we talk about those later. But after the money runs out, how do you plan on continuing this work and not just cutting it off and, the program ends and, we finished with it and we kept moving forward, because we know this is going to be an ongoing effort that we'll have to continue, putting pressure upon. So number 4 is our budget narrative. So in part 4, this is where you're going to outline all of your funding information for the specific project that you are requesting. So this information is about what you plan to do for this particular project. All right, you will need to enter an itemized budget form, which is included here. You'll see the link here. You'll click on that. It'll give you some really detailed instructions. And the next page there is a little spreadsheet that you can fill out. And once you've done that and saved it, you just click Add Here and you upload it to the form. One of the things that I did want to point out is some of the eligible and non-eligible expenditures. If you actually open up this document, and let me just give it an open while we're here. Let's close these. You'll see a list of allowable projects and purchases, and then some of the unallowable costs. Those include allowable, hiring additional personnel, project and program evaluation if you need funds for that, overtime, supplies, training, travel expenses, food, stipends and incentives. All of that is allowable. Some of the things that are not allowable are purchasing weapons and ammunition, construction or renovation, land acquisition, lobbying and political contributions, alcohol, vehicles, and also bonuses are on that list. So that is the document that you will need to upload in part 4. And then part 5 would be those required attachments that we spoke about a bit earlier. Again, we are here listed as a 501c3. You will just go to each one of these and upload the document that it's asking you for. I'll show you really quickly. If we go back up to the top and we answer no to this question, then that list of documents is now changed to relevant documents to a legal entity or a legal business. You upload all those informations and all that information, and you'll see a beautiful blue button down here that says Submit Application. That is it. That's the application process. So cut and dry, straightforward. Again, I'm available via email. You have my information. If you did not receive an email from me, you will after this because I have your information out there, and I will start hounding you from there. Last but not least, there is another document that was at that table, number 3, which would be that timeline that we talked about. I just wanted to draw your attention to that. I'm not going to go through it verbally, but you have it there. It just gives you all of the dates and information of the actual schedule for this entire application process, so you know exactly when to expect what action to happen, all right? Thank you all for writing your questions down on the sheet of paper. It's really important because we want to make sure that the questions get read on this microphone so that the recording can actually hear the questions. Once this is all said and done, I'm working with our communications folks to have a paste on the website for the project to have all the questions and answers that have been asked in this forum as well as emailed to me. And we'll have all those questions there. So if you ask a question via email, I may come back to you and say, give it 2 days, and then check the website, and the answer to your question will be listed on the website, all right? We want to make sure that everybody in this room and everybody that's involved benefits from the questions and answers that are being asked one-on-one between individuals and myself, because it may be something that someone else didn't know they wanted to ask, all right? So that would be the application review. They're coming around and collecting those questions. Next section would be Ms. Tracy Snell.
If you have questions already or need
I'm
a
sure.
blank card, anybody?
Sure. Yes, ma'am. Yes, ma'am. You wanted the list of documents right here?
No, my question pertains to the audited financial statement by independent certified public accountant.
Sure. Okay.
Where-
I'll jot that down.
That's my question.
Okay.
Because of I just need clarity around that. Because that's a showstopper for a lot of small businesses. And so whoever is going to address that, please elaborate in more detail.
We can talk about that.
Okay, thank you.
Q&A. So I'm the last section that stands between you and the Q&A, so I will go as quickly as possible. My name is Tracy Snell. I oversee prevention and self-sufficiency services programs for the Department of Human Services. I work with David. His programs are one of the programs I work with in community and family development. So I get to talk to you about project requirements and evaluation, how your application is going to be reviewed and evaluated, and what reporting requirements are, as far as we know right now. So everything I'm going to tell you is on the 4-page handout that you got, so I'm not going to read it to you. I just want to give you a high-level overview. So project requirements, one of the biggest things we're going to look at, as has already been mentioned tonight, is that your project implements something related to prevention or intervention. Those are the two main components of our peer model that we're looking at for these projects. And so obviously, preventing youth and young adults from either engaging in violent behaviors or victimized by violent behaviors, or, reducing their risk of participation. Intervention programs, young people who are already participating or at high risk of participating in violent behaviors. So really focus on prevention or intervention programs. We'd like to see projects that are foundation in evidence-based programs, and your evidence-based programs are really just data-driven. They're proven to be effective for prevention and intervention. So there are, if you're not familiar with some evidence-based programs, there are websites you can go to, like through the Office of Justice Programs or Department of Criminal Justice Services. If you're not familiar, reach out to us. We'll be happy to give you some websites that you can look at so you can see what some of those evidence-based programs are. On the bottom of the first page and the top of the second page, it lists the goals and objectives that we're looking for these projects. Again, collaboration, one of the big things we're looking at. So if one of the goals is potentially increasing that collaboration among community-based organizations, city departments, other key stakeholders that are in this work with us. So if you have a project that can help to increase and establish that collaboration, then that would be a good project to create from here. Reducing incidents of gun violence, again, the age range 13 to 24 is what we're really looking for. You want to be implementing prevention and intervention programs that will reduce that risk. This is also where some of that the data from the survey comes in, really looking at those pieces that were identified in the survey as the gaps and needs that the community identified. So mental health services, education, anything that prevents and reduces violence, but really focusing on what was the results of those surveys and how can we take that data, create a program, and use it in our prevention or intervention work. Decreasing barriers, again, Dr. Keener talked about one of the biggest things we found was that young people didn't know how to access programs. And we all know there are so many programs and resources out there to help young people and families, but we hear it all the time, and we hear it a lot in human services, that people just don't know how to access. They don't know that the services are there. So if you can decrease barriers, to young people accessing those services, increase the community education and awareness of what's out there, increase community education and awareness around gun violence reduction. What can we do? And a lot of you are already doing that work. So what's a project that you're already working on around gun violence reduction and community awareness of that? How can you enhance that project? That would fit here. So then, as far as when we evaluate the project or the proposal, we're going to be looking for all of those things, those project requirements. Were you able to meet those goals and objectives? But when we evaluate your application, we're going to be looking specifically at 4 kind of focus areas. One is effectiveness. And so is the project that you're proposing going to meet those goals and objectives that we just talked about and that are listed on these instructions? Your reach for the program, how many, or what is the number of youth you're going to be able to service in Newport News specifically, because these projects do have to service Newport News youth. Replicability. If you are creating a project and you're servicing a particular neighborhood or area of the city with your project, how likely is it that we can take that project and recreate it somewhere in another neighborhood or area of the city? And one of the biggest things we're going to be looking at is the connection to the identified need. So those data points that Dr. Keener talked about that came out of the community assessment, the CDC risk factors that Miranda talked about, we're really going to be looking at, does your proposal really pull in those assessment results and those risk factors, and how are you developing your project to really support and address those different pieces? So that's a big one. So I want to make sure that everybody remembers. If you aren't sure about the risk factors, you need more information, go to the CDC website, reach out to us. We're happy to share additional information with you. And then as far as reporting requirements, if you're awarded a grant, we don't have the final performance measures design yet. Dr. Keener and his team are going to be developing the performance measures that we're going to have the grantees to report on, but it will be monthly reporting. So we will be creating a reporting form for you, and we'll be asking you to send in a report every month to report on your performance measures. How are you meeting those performance measures? And again, we don't have them completely designed yet, but they're going to be around the outcomes, the goals, objectives, the results of the survey, and the goal of the project overall, which is reduction of gun violence. So as more information is developed about the performance measures, those organizations that are awarded funds will be we'll receive information from Dr. Keener and his team to come to some training sessions, and we'll be able to share information with you about all of that and what the expectation is going to be. But we will definitely not make it complex or difficult. We want to make it as easy as possible for all of us. So that information will come out to you later. So that is it for me. Q&A.
Yes. All right. Any more cards? I feel like I should be winning a game or some money or something like that with all the cards. Who else? You can bring, I'll meet you halfway. All right. Yes, please do.
Just wanted to reiterate, if we're not able to get to every question tonight, or if we may need to do some discussing to make some decisions about the answer to a particular question, I wanted to make sure everyone knew that you can email me. I will be in contact with you all again, not badgering, but just informing to ensure that everything gets answered, and we'll be able to refer you to that website so that everyone can see those answers. So if you don't get to it, or if we don't have the answer, we will make sure we get that answer to you, okay? Just wanted to say that.
All right, let the Q&A game begin. All right. Okay, so first question. What is the name and email of the gentleman that will help with the application?
I missed the first question.
No worries. What is the name and email of the gentleman that will help with the application?
I got that one. My name is David Duck, and my email is duckdj, DUCK, at nnva.gov. But I'll do you one better. If you signed in at the table, I will email you.
So that means if you did not sign in when you came in the room, make sure before you leave you sign in, and you'll get an email from David. All right. Are there any formatting or word page limit guidelines that we should be aware of? So no, because everything is in the online portal. So as you type it in, you just type. It'll automatically format. So I think we've made the process a little easier in that way, so you don't have to worry about, does it have to be Times New Roman 12 font? Everything is, you all have seen the applications, and they ask for Arial 11, it's gotta be double spaced and all of those type of things. You won't have to worry about that. Everything will be automated for you, okay? So I think a couple other people might have had a similar question, so I think we probably addressed that one. Will the list of community organizations be shared? Yes.
So sure, I'll send out an email once we get a little bit deeper into it, and I'll ask if there's any organization that did not want to be shared. But other than that, in order to collaborate, we want to make sure that everyone knows who else is involved. So I will be putting that information out there, minus any organization that does not want their information put out there. But, that makes sense, huh?
Yes. And so this question, I think, may be similar to the one that was asked just a few minutes ago. Is there a particular format that the program description should be written in? Again, you just follow the inputting process. I think probably what we would ask, because I don't think it naturally double spaces between paragraphs, like if you're writing a long description for us, give us a little double space between the paragraphs so we know, oh, they're moving on to the next thought. That probably would be a little bit helpful, okay? All right, what if I cannot obtain a business license with or for the nonprofit 501c3? Is the business license mandatory with all other documents in place? Yes, you must have an active, valid business license. I will say the process is very easy, though, here in the city to get a business license. Oh, yes, ma'am. Yes, ma'am.
To attach it to my nonprofit, and they said that I couldn't get one because the thing is, my nonprofit is housing women coming out of the reentry program. Actually, Mr. Morgan invited me to this.
Okay.
But I don't have a dwelling yet, so they said that I can't until I get a dwelling for the young ladies to come into, that I can't get a business license.
Let me repeat back what I believe I heard you say. You were told that because you don't have a physical building where you're going to house the participants in your program yet, you cannot get a business license. So there may be a slight...
I got all my documents in place, my organization.
You got your articles of organization, you have all your documentation from SCC. Okay, so I'm gonna put your card aside. Can you have a moment to hang out afterwards, and maybe talk through a little bit, because I'm wondering if there might just be a breakdown in communication in terms of, getting the license, because you shouldn't need that for the license, but if you hang out, let's see how we can assist you. You're welcome. Can an organization submit more than one proposal? Unfortunately, no. We love you one time over. Okay? All right. When we collaborate, where would that be noted on the application? David, do you want to respond to that?
Yes. On part 3, I believe, where it asks for your project information, you will just put that in the narrative form that I'm going to be working with this organization and this is what we plan to do together. So part 3 of the application that says project information is where you put that in there.
And I believe on another card I haven't gotten to yet, but I saw that there was, may have been a question of who should submit the proposal. So let's say David and I have organizations and we decide to collaborate. Who should submit the application? And so there would be a choice between us as to which organization would be the representative organization for the one application. Okay. Can I use my EIN number for my business, or do I have to have one for the evidence-based program I'm associated with? No, just for your business. You should have your federally issued employer identification number for your business, and that's applicable to any projects or programming that you have. All right, so audited financial statements by independent certified public accountant, or I can't read this word, or financial statements reviewed by a certified third party. Please provide clarity on what's actually required. This is could be a showstopper for most small businesses. So I think this speaks to one of the things that David mentioned is that there's going to be a place where there's a drop-down menu. It asks if you're a 501c3 or if you're not a 501c3. So if you're not a 501c3, your required documents look different. You don't have to provide a certified copy of financial documentation. Your lineup is different. So if you don't fall into that category, and this is off the top of my head, I believe that you can either provide a copy of your 990 or your 990 EZ statement. Thank you, David. Or if you're filing on a Schedule C on your 1040, you can provide that in internal financial or internal financial statements reviewed by a certified third party. So there's an or there. You have a couple of options depending on which category you fall in.
So that's my question.
Okay.
And I say that because I do have a 501c3,
Yes,
and
ma'am.
that has been a showstopper because of the small business. One,
Mm-hmm.
what small business can afford to be audited, right?
Mm-hmm. Yep.
So that, and a lot of the major banks, the big
Mm-hmm.
cities, the big organizations, that is what you guys are requiring. So that wipes us out immediately because we cannot provide that kind of information. So that's exit stage left. So that's the first thing that I wanted to ask. And then 2, you said certified. So again, that falls under the same thing. We're coming COVID, right? A lot of the small businesses have been devastated. And so the requirements, what I'm reading to me says red tape,
Okay.
clearly, red tape, right out the box,
Yep.
right up front. This is what we're up against. And so these small businesses who are not used to filling out grants,
Yep.
who are not used to, who are not used to filling out grants and providing this kind of information, like I said before, that's a showstopper. It's not clear, and then when we get into the weeds of it, then you want 2 or 3 years of information, and by then you're like, really? Like, okay, thank you, but no thank you, because of the number of the infrastructure that's in place to keep us out. So that's what I'm talking about.
Yes.
I understand the statements, I understand all of that, but my question is, what are the red tapes? What does this infrastructure, and you guys have us all here saying, hey, we want to play, because this is what I hear you saying. We want to play with y'all, and we're serious about this. And it doesn't matter how the equipment, what the equipment looks like in your playground. In a sense, it does. We want to make sure that it's, properly, that it functions properly. Now, bring all your equipment and your toys and your game's into our playground. But here are the requirements to get into our playground. And so that's what I hear. And so what I'm asking is, what are those requirements? Let's lay them out clearly so we're clear from day one, because I don't want to waste my time on another grant.
Okay.
And then I turn around and get the same old, right? Oh, thank you for applying. We really appreciate it.
Yep.
And I get that fat no. So that's a waste of time and a waste of energy.
Yep.
And I don't want to be sitting here knowing that I'm about to waste my time based off of what I'm reading.
Yep.
See, and so for those who haven't applied, there are certain things that they're not aware of.
Yep.
But I applied, and I'm clear on what those showstoppers are, and I see it
Yep.
in your application.
So if we both take a breath.
I don't need to breathe. I'm
We're
good.
gonna, I'm gonna respond to your question,
Please.
and then you let me know if this is helpful for you.
Yes.
So this is what I heard, is clearly your frustration with processes, with grants, of having to go through red tape that you were not aware of before you got through the process, or you complete the process, and then you're told, oops, you were supposed to have this, you don't wanna have that experience again, which I'm sure a lot of people in the room don't want to have that same experience. So here's how I think that we have helped to address that, and I heard you lead off with that you are a 501c3 organization. So one of the things that we did is that in lieu of the audited financial statements prepared by independent CPA, there's another option that you could use your most recent IRS filing, your 990 or your 990 EZ form.
Okay. But what if those people did a 990 EZ postcard? Ooh.
Okay,
You
well,
see
no,
what
it's
I'm
not,
saying?
it's not ooh.
No,
So
but
let's-
I'm putting that out there because you didn't say that.
Right, right.
And don't get me
Right.
wrong, I'm not going back and forth with you.
Right, no, not at all.
I'm bringing up issues that goes hush,
Yep.
that goes by the wayside for people who
Right.
have not.
Yep.
Because I've experienced it. So my point is,
Yep.
doctor, I don't need to breathe. I just need to share. And I just
Yeah.
need the clarity, okay?
I got you. So
Okay, good.
what I just heard you say
Okay.
was, what about the 990 postcard as an
Yes.
option? So my response to you is, let me check on the 990 postcard.
Thank you.
Because what we did in hopes of alleviating the challenge with the audited financial statements was to offer the 990 as an alternative, because as you
Right.
stated, many people don't have that. We
Right.
removed also the barrier of you have to have the last 3 years of these statements. We are in agreement with you
Okay.
that those are barriers. That's why
Okay.
we removed them.
Okay.
Now, specific to your question about the 990 postcard,
Okay.
I'm making a note.
Please.
And if you give us an opportunity to follow up with you, because I don't want to tell you prematurely, we might have an answer before you leave tonight.
Perfect.
But as of now, where it stands for anyone else who has a similar question is that you have the alternative of doing or 990 or 990 easy. Yes.
The 990 EZ can also be filed as a postcard.
Well, then there's clarity. I did learn something new. Thank you.
But it's not listed.
Yep.
As,
They
right,
don't know
so,
that.
right, I understand.
Right.
And so that was my point.
So here's what we can do, because we've learned something new.
Okay,
So that's the
I'm
easy
glad I
update.
came.
We're here to grow together.
absolutely.
So
Absolutely.
we can add that language
Yes.
to the application for those who are not in this space.
Right.
We can add that language.
And here's my point, and let me just say this, most small businesses have not generated over $50,000 so that they can go that route. That's why it's easier for them to go the 990 easy postcard.
Yeah,
Okay, and that's why I'm saying that.
gotcha.
Okay,
Thank you.
clear,
Perfect.
yes.
I saw your hand.
Can you see me? I got some resources.
You talking to me? Absolutely, and what's your name?
Renee.
Renee, got it. I'm Kim, thank you.
Perfect. All right.
To piggyback on what a statement I'm getting, what if you're just starting up as a nonprofit and you don't have any of that at all?
So you don't have you don't have a 990 filing, of course, and you wouldn't have internal documents because you just started. Yep. Well, come on, Alex.
I've been standing, I've been waiting. This is my moment. Yes, if you're a startup, I mean, much of the discussion here is just hearing from you all today so that we can understand more clearly how we can better provide you with these funds. That's the ultimate goal. Those requirements are in this document because for those individuals who are reviewing the applications, all they want to see is some demonstrated financial history that shows responsibility. And I would say that if you're a startup and you don't have that, it is not a deal breaker. You should go forward with your grant application and clearly note that. And those individuals who are reviewing the applications, if they have questions that they need to get clarity about with you as it regards, with regard to your submission, then they will do that and get that clarity. But it is not a deal breaker if you are a startup.
Yes. I was gonna add to that, the other option that you have is David Duck, who is your point of contact. If you have questions like that or you're afraid that it's gonna keep you from submitting your application, you'll wanna reach out to David and just say, hey, this is the missing piece I have, this is the reason why I have that missing piece, and then he can assist you in walking through how do we make sure we still get your application through. Yep. You ready to move on? Fantastic. All right, can you continue to update volunteer documents with criminal history and sex offender search after grant awarding? For example, if volunteers were college students, so I think to make sure I'm clear, let's say after you're awarded, you pass that 30-day period, you bring on a college student intern, volunteer or something like that, can you add their information to the record? Yep, okay. And so I would say yes, Mr. Archer, unless you have, anybody else has a different response, I would say you can add, as you add new people to your roster, you'll want to make sure that you send that updated information. And again, that would be critical to have that point of contact with David Duck to make sure you say, oh, I need to add somebody else, and then we can make sure that documentation is included. Yes?
Yes, and actually, we would want you to do that. So if you do have new staff or volunteers or interns come on board, they also have to have a criminal and sex offender check. So we would definitely want you to do that, so please. And David would definitely be your point of contact with it.
Yes. Okay, so there were several questions that came in, Mr. Archer. There is a question around, is there a minimum or maximum amount of dollars organizations can apply for? And there were several similar questions around the question of how much is available, what can you apply for? Is there a limited amount that you can apply for? So would you like to respond to those questions?
So we have three sources of funding for this initiative. One source comes from DCJS funds that we have identified and allocated for this effort. Another source comes directly from the Attorney General's office that we have received that have been targeted specifically for this effort. And a third source is dollars that come directly from the city's general fund, which the city manager and city council have identified as a third pot of funding. So we've been intentionally vague about setting limits on your ideas, and that's done for a reason. We want to hear what your ideas are. We don't want to impose limits on your thoughts at this point. We want to have the ability to scale up, and if we need to, scale down. But let's start with getting your ideas first, and then we'll go from there. Okay. Yes, sir.
Who would decide who gets the grants? Is it the same people that's been deciding for years? No, because, I mean, seriously. Because what we're gonna do is fall into the same situation and get the same result. If the same people are deciding the grants.
So that's what we're trying to prevent from happening. We're trying to remove those barriers. And so from the evaluation standpoint, there's going to be a committee of people that are going to be put together that are going to review the applications, and each person will have input in that decision. All those the criteria that's listed in the 4 pages that I went over a little while ago, those are the criteria we're going to look at when we're evaluating the grant. And so that committee is going to make a decision together. And so no, it's not the same committees that have approved grants or reviewed grants in previously. This is going to be a new committee put together specifically for this project. And we are trying to remove all of those barriers and be able to fund as many projects as we can with this funding.
And we hope to have new partners. I think that's important. That's why we're all here. We really hope to have new partners in this work. All right. So I'm not sure if this has been answered or not. If not, just let me know. It says, if we are a new business and have no IRS info to report because of not having, did I address that for whomever asked? Perfect. All right. Okay. I think we did that one. Okay, here's a new one. Are organizations who receive City of Newport News Community Service Agency grants eligible to apply for this funding stream? CSAGs? Yep. Are organizations who receive City of Newport News CSAGs eligible?
Yes, because this is a separate, totally separate grant program. So even if you're receiving CSAG funds, you can submit an application. I would encourage you to submit an application for a different project than what you're doing with CSAG, because you're already getting funding for that other project. But yes, absolutely. Oh, here's another one that came in.
Thank you.
Are you ready?
You're ready? Top one, okay. All right. First question, are we able to use stipends/incentives for program work, or is this for the youth targeted, or both? And then there's a subsequent question that may fall in that category. Okay, thank you. Are funds allowed to be used for equipment such as computers and laptops? So I'll answer those first two questions and I'll get to your third question. On page 3 of your handout, there is a list of eligible expenditures and things that funds cannot be used for. So they can be used for hiring additional personnel, project and program evaluation, overtime supplies, training, travel expenses, food, stipends, and incentives. So you can use stipends and incentives for the youth who are participating in your program. You can use the funds for that. Of course, they may not be used for weapons or ammunition, construction or renovation, land acquisition, lobbying and political contributions, bonuses, alcohol, and vehicles.
So that computer equipment would be under supplies in that first section.
Thank you, Dave. Computer and equipment will be up under supplies under eligible expenditures. All right, so there was a final question on this card. Are Newport News Public Schools allowed to be involved as collaborators? Great question. Who wants to tackle that from the team?
I would say yes.
Mr. Archer says yes. Yes, and so I think those have already been responded to. One was, are there character word limits for each grant section and expected levels of funding? All right. Thank you. All right, here's a question. Can a convicted felon who has not been convicted of a crime against children or sex offender serve as a volunteer? So a convicted felon but has not been convicted of a crime against children or sex offender, can they serve as a volunteer?
So typically, when it comes to providing services and working with young people, is child barrier crimes. So as long as it's not a child barrier crime, I think we could consider that person eligible to work with the program.
Yep.
Alan, you have something.
And on, if you want to make sure you have a clear listing of child barrier crimes, on page 2 of the instruction packet, it is the second note up under eligibility requirements. There's a code section listed there, and if you look up that code section online, it gives you a list of all the child barrier related crimes, so you can match that up against the status of your volunteers. Yes, sir.
I know y'all used a lot about collaborating with other organizations. Will there be a time where we know what other organizations are doing so we can possibly collaborate with them?
You want to respond to that first?
Yeah, I'm going to send out the list of who the organizations are, but that is a great question to see the content of what they plan on proposing, and you can.
Mr. Archer?
So one question might be, would it be helpful if, I mean, sort of has to be done by consensus, but I mean, would it be helpful for you all at some point in time to just see a list of the other projects that are being proposed. So you could sort of say, well, I mean, I didn't know that so-and-so was doing that, and reach out to them. I mean, we could facilitate that. Just the top.
I think that would be helpful, or maybe even just like create a Google Doc, and each organization list maybe like 3 or 4 key areas that they focus on in general, and we can kind of like connect, before that in general.
I'm sorry, are we talking about the organization's current focus areas or what they're planning to focus on the application?
Good question.
It could probably be both. I mean, I'm assuming like, if you're focusing on 1 or 2 issues or whatever.
I think it's gonna be difficult for people to tell you prior to submitting the application what they're gonna submit. But if you registered with the city's nonprofit request when this all started, it asks you to list certain areas that you are covering. And that probably will give you an idea of who's doing what and a basis of who to contact versus asking people to submit something prior to the application being submitted.
Yep.
Just my 2 cents.
Or we could create, I think we can do this through our IT support, we could create a forum and you all could post. You could post and just start the collaboration that way. You could post it, somebody picks up on it, guys get together and go forward.
Yep.
Thank you.
Perfect. All right, so we're almost rounding the bend because some of the questions are similar that we have already addressed. There is one here that says most of the time was spent on risk factors. What about organizations who strengthen protective factors? Will you be considered? Absolutely. So what we did in focusing on risk factors is really being able to link the literature from CDC with the findings from our local community that Dr. Keener presented so that you can begin to think about your projects in terms of what is a need that you're going to address. Because one of the things that's on the application is it asks you to do a need statement. So we focus in on the risk factors to get you thinking about where are the gaps, where are the holes, where can I plug in with the services that I'm going to offer. So if you are already working those protective factors, what you'll want to do is make sure that you put that into not only in the project description, but I think there's another section that you'll be able to plug in that shows your capacity, organizational capacity, and you'll talk about your protective factors that your programming and your projects already address. Okay? So hopefully that was helpful. How can we look at how food insecurity plays a role in crimes? Great question. So I think if that is a focus area that your organization has, two things come to mind for me and other people from the team respond. One, I would encourage you to perhaps reach out to Dr. Keener. One of the things he mentioned was that if you have other areas that you're interested in finding data sets for to support something you want to do around, like, let's say, food insecurity, he may be able to assist you in finding data that will support what you already know is a need, but then you can take that information and plug it into your proposal. So that would be my first suggestion, is to reach out to Dr. Keener for support. And then the other thing is that if you have a project or programming that you've already been doing, and by virtue of outcomes and results that you're seeing as a result of addressing food insecurity, you can plug that in to demonstrate that it is a need and how that links up to gun violence reduction or reducing crime in general in a community. So I think, one, think in terms of what you're already doing and what you see as results and outcomes and report that. And two, also look at external resources that you can tap into support with that as well. I have some ideas. If whoever asked that question, if you want to chat with me afterwards, I have some suggestions that might help you.
And I'll also just add that addressing food insecurity is also a CDC documented risk factor. So it falls right into line of what we're trying to do.
Yep. Yes, sir.
One last thing, I just want to thank y'all for this amazing presentation. A lot of times you hear about grants and communities, but they just put the grant is available, but don't give you the opportunity to learn and even ask questions. All you know is, like everybody in here, we're passionate about the work, we're doing the work, and we just do it whether money is involved or not. But a lot of times if there's funding involved in sessions, like I appreciate this session 100% because we can use this data and knowledge that's given to us today to apply for state and federal grants, you know? So I just want to say I appreciate y'all for doing this, and I look for more sessions like this, because me growing up in the 23607 zip code, you heard about grants, but you don't know the ability or the way to apply for a grant. So I just say, thank y'all for this presentation. It was amazing, and I look forward to working with everyone in this room to move Newport News forward in the right direction, because if we don't do it now, it's either now or never. So I thank y'all for even taking the time, because you didn't have to do this. You just could have said, the grant is available, apply here, deadline here, due date there, and we all don't have the opportunity to ask these questions. So I just thank y'all for the opportunity.
Yeah, thank you so much. And that was our commitment in the city when Mr. Archer pulled us together as a team to work on gun violence reduction initiatives, was looking at, one, how do we mobilize community-based organizations, but two, how do we support organizations, not just for this grant funding stream, but what can we help you with that, like you said, you can now go after state and federal funds and feel like you have the competence to be able to do it because you're doing the work, but sometimes you don't have the know-how of applying for grants. And so that was part of our goalpost. So thank you so much for offering that. So I know my time is coming to an end, and I just have two things I want to address.
I just want to say something intentional, because the gentleman asked the question earlier, and I'm not saying it just because we have council people in the room, but this was a mandate, sir, to your question earlier, to ensure that when we went through this process this time, it would be different and it would deliver very different and intentional outcomes. So everything about what we're doing, I'd like for you to help us think the word reinvent. So this is not, I hope the outcome of this process is very different for all of you compared to what you have, participated and been a part of in the past. This is very deliberate strategy, and we appreciate being here.
All right, so just two last questions, if I have permission, sir, to do that. So one is, if a city official is a board member / president of an applying nonprofit, will that organization still be considered?
Ask the question again.
Would you like to say that? Would you like to say that louder? No? Okay. If the question is, if a city official is a board member or president of a nonprofit that wants to apply for funding, can they still be considered?
I'd be happy to talk to that person.
Yes.
We need conflict of interest, just, that.
That person, but he's directly involved with you, and he's not the one that's going to be applying for this, so it shouldn't be a conflict.
Yeah, as long as we can demonstrate there's no conflict of interest, then it's a common occurrence, and there's a way around it.
So still follow up, hang tight if you have a little time. All right, so Mr. Morrell, who's in the room, Mr. Morrell, can you hang around for us? We have an answer to your question. Can you come up front before you leave, please?
Okay, I really wanted everybody in the room to actually know this for real.
You want me to, I can read it aloud, that's fine.
Oh, yeah, you can, because
Okay.
I don't have no problem with it.
Okay.
I've been through something to get here, you know what I mean? I did 8.5 years in prison. I got out in 2008, I've been on the straight and narrow ever since. I ain't been locked back up or nothing. I'm a master electrician, CDL, B license, I own my own business. Actually, I work for the state right now, so I'm all over the place. God good. But what I was getting at, I want to get into the juvenile center and start talking with the kids. I get the grant, what y'all trying to do. I might apply for it, I might not. But the thing is, I want to get into the juvenile center. Just a backdrop, I physically went in twice. Turned in my volunteer application. And they both times told me they lost it or they didn't get it or whatever. It's nonsense. So I'm trying to do something, be proactive about, and mine is just really just interacting with the youth. I got kids, my middle kid is about to graduate from ODU for engineering. My oldest daughter's doing good. I got a 13-year-old, ain't none of them been locked up. They ain't been in no trouble. They don't want to be with no guns or nothing. Because I talk straightforward with them and just tell them the positives of what can be and, you know what I mean, and what they'll do if they go down this opposite road. And that's, I think, I ain't never really get that coming up. Don't nobody explain you the positive side and the negative side. They just tell you, well, look, you better just do this right here. But they don't say, hey, you actually can go to jail, and be in there for an awfully long time. It's not like what you see on TV, people just jumping back and forth out, like that.
Yep, no, we actually come to the front because we think we have a resolution for you to help you. Yes.
Trying to ignore your question.
No. And I certainly didn't think you was embarrassed. That wasn't why I didn't want to read it. I think we have an answer how we can support you in getting that done. So that's why we want to see you at the front. Okay, all right. Okay. All right, so one final question, and then I'm turning it over to Mr. Duck to wrap us up. And we will be up front if you have more individual questions after it's over, but we just want to honor everybody's time in terms of the commitment to go till 7:30. Yes, ma'am.
I had a comment right after him. You remember me raising my hand?
Yes, ma'am, I do.
You said you would get back to me, but
Yes, ma'am.
I wanted to talk about how, you know, in my neighborhood, I say downtown Newport News. And last night, there was a shooting in my neighborhood, and most of the time, I feel that we need more policing, as this one of these documents say, because I live in the neighborhood that I live in. Out of, I'll say 20 houses maybe on this block, 15 of those houses are elderly people that live by themselves, that been there for years, that raise their children there, and it's really scary for them, man. And I do live in a community because of that reason, that these are elderly people, the people my age, and, you know, we look out for them. You know, and they are terrified, man. There was a shooting last night, and it be the people that don't even live there that come around and start trouble and make scenes, you know what I mean?
Yes, ma'am.
So it's, you know, if we could, and he's talking about, we here to talk about the youth, but the elderly, man, they need help.
Yes, ma'am.
They need people to secure them, man, and help make them feel safe.
Yeah.
Because they are all alone.
Yes, ma'am.
And these young people out here, they smart kids, they got minds. I know what the purpose is, but they can do for themselves. These people can't do for themselves. We need some stuff that, just like y'all doing here tonight, please, 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 set up some things that we can do for the organizations, for the communities to get together and help these older people.
Yes, ma'am. Thank you so much. We appreciate that. All right, so, Mr. Duck.
I'm going to let Mr. Archer have the final words, but I did want to say thank you all for coming tonight. Again, please contact me if you need support. Our goal here is to also create community within all of these organizations that are represented. So when it comes to that collaboration conversation, I know it can be a bit tricky because we want to make sure that we're working together, but we also may individually feel like it's competitive. So maybe we don't want to share all of our ideas with each other to, you know, because, you know, maybe I may not be funded, someone may take my idea, but I want to have everyone rest assured that our goal here is to make sure that community agencies get these funds in their hands to do this work. So ultimately, it's up to you. Once I reach out and I start talking about the ways that we can share our information with each other to collaborate, individually it's up to you whether you would like to participate in that process. But those that do, please respond and give us your information so that we can build those bridges and these projects can connect together. Again, we did not put a limitation on the dollar amount because we don't want to stifle people's creativity and their ideas. And just know that with that shifting and maybe asking to scale back and scale up here and there, we want to make sure that everybody is accommodated in some way. Even if we have to ask you to scale back a bit, we do want to make sure that all of these projects, as you work to submit the application and I work with you to help make sure that everything is in tip-top shape, that all of them can participate in some way. So thank you, and I'll give Mr. Archer the last words.
Yeah, I'm not gonna belabor. I just want to thank everybody once again. The solutions are in this room. You guys work with other people who have solutions. Help them be a part of this discussion, be a part of the proposals that we receive going forward. Who's your project coordinator?
David Duck.
That didn't sound too confident. I don't know.
Mr. Duck.
I think you might need to ask him again.
And I want to thank my team for all the hard work that they have put in for this effort. Thank you.